Hello, welcome to another episode of Black Ice 73. Man, you know how I said the other day there were only two continents that haven't been affected by the coronavirus? Well, today, Brazil. Now in South America, they received, they confirmed their first case of coronavirus in South America. It was a 61-year-old person who came from northern Italy, came back home to Brazil. It was confirmed that they had the coronavirus. Now they're trying to scramble to find the other people who were on the plane with him. I think it was him. Yeah, with him. Now they on trying to find the passenger that were on the plane with him. I told you, man. Okay, here goes some of this article right here. Brazil health minister said on Wednesday that a 61-year-old man was recently traveled to from Italy has contracted the coronavirus. They said the first known case in Latin America. It comes as Brazil is in the midst of carnival, a huge popular fest that draws large crowds in a closed quarter for street celebrations. Officials were scrambling to track down other passengers on the flight the man took to Brazil and to find others who had come in contact with him in recent days. The patient, who lives in Sao Paulo, had recently traveled from work in northern Italy, where an outbreak has affected at least 325 people. He sought medical help after experiencing a fever, cough, and sore throats, according to health officials. Brazil health minister told the GI news site that officials were hopeful that the virus would not spread briskly to Brazil, given the given the warmer time of the year. The virus behave different in northern hemisphere and southern hemisphere, he said. How did they know? Who released this theory saying the virus behave different in northern hemisphere than southern hemisphere? They said Brazil is a country of younger people and we're in summertime. This is a period that is not, but the disease just took place in December. They just found about it in December. So how you gonna come up with saying it react different in the northern than the southern? I don't know. So right now, as of today, the virus have affected. You know, uh, you know, Monday when I said it was just 76,000, I think it was. Now, so today is 81,900 people in China and 40 other countries. Since Monday, it been 5,000 more people affected by the coronavirus or COVID-19. I'm telling y'all, I believe they want this virus to spread worldwide. So it's only one continent now that haven't been affected. That's Africa. And soon they're gonna take it to Africa too. Cause they knew that this virus was that contagious and it was happening in northern Italy. Why would they let that man return just like that. What do you think? Do you think they purposely took that virus to South America? Cause I think the only reason it's not a pandemic, I think they didn't consider this as a pandemic because it wasn't worldwide yet. So they're gonna let a man come from northern Italy, what a hot spot at, the new hot spot at, and just let him go to Brazil and be on a flight with other people. And you wait days later before, you know, days later after you came in contact with other people now throughout the country. Man, I know I keep saying it, but I guess they really have found out the way to help depopulate the earth. Why they want us dead so bad? I'm talking as a human existence. Why do they want us dead so bad? What we doing to have them spreading this virus throughout the world? See, and yesterday, San Francisco mayor declared a state of emergency just in case. Cause San Francisco got one of them areas in their city is Chinatown. So just in case. And now the death toll don't rise too. Have rise. It's 2,770 people died. It's dead right now. Once COVID-19. It said the growing number of COVID-19 cases and death outside of Asia has put pressure on United States officials to more clearly uh, prepare plans and make preparations plans in effect to ease American worries about the possibility of the pandemic. As President Trump tweeted Wednesday that he plans to hold a news conference on Wednesday evening about the coronavirus, saying the U.S. is in great shape. Health and Human Service Secretary Alex Azar, who is leading Trump coronavirus task force, is expected to be asked questions about the United States response to the outbreak in both of his scheduled appearances on Capitol Hill on Wednesday. And separately, Senator Chuck Schumer is seeking $8.5 billion in new funding to fight the COVID-19 outbreak, a figure that is more than 3 times the 1.25 billion in the new funding that the Trump administration requested from Congress earlier this week. They said America needs to know that their government is preparing to handle the situation before the coronavirus spread to our communities. The following day in which a Center of Disease Control and Prevention official urged Americans to prepare for the spread of the virus in their community, saying that the parents should take their children school. Saying the parents should take their children schools about. Wait, my bad. I keep on saying take. I don't know why I keep on saying take. They said the parents should talk to their children's school about closure protocols and workers should ask about work from home policies. These comments mark a shift in how the United States health officials have talked about the outbreak to Americans. They said there is now 81,245 confirmed cases of COVID-19 and at least 2,770 deaths, according to the tally of the cases published by the Johns Hopkins Whiting School of Engineering Center of System Science and Engineering. That's the name right there, dog. They said the increase in cases overnight has primarily been driven by new cases in Iran. They said now it's 139 cases and 19 deaths. Italy, 374 cases and 12 deaths. Japan, 178 cases and 2 deaths. South Korea, 1,261 cases and 12 deaths. While the outbreak has largely affected China, China Hubei Partners has reported 94% of total deaths, and mainland China has 96% of total cases. The merge in the COVID-19 cluster in these other countries has alarmed markets in recent days. It's in the United States, there are at least 59 cases, though 45 positive tests are in people who came from Wuhan, China, the epicenter of the outbreak, or the Diamond Prince cruise ship docked in the port of Yokohama, Japan, according to figures provided by the Center of Disease Control and Prevention officials on Tuesday. The virus was first detected in December in Wuhan. Y'all heard the amount that they requesting. What would this $8.5 billion in new fundings to fight the COVID-19 outbreak go? Where would it go? What would it money be used for? Chuck Schumer, Democrat from New York, asking for $5 billion to fight. President Trump had asked for $1.25 billion to fight. But they're not saying what they're going to use the money to fight. Is it going into scientists searching for a cure? Or are they finding other ways to build concentration camps or something like that for quarantine people? As I was picking up my daughter from school, the principal sent out a call saying one student was sick, but he had to send out a confirm saying this student do not have COVID-19 and there's nobody in our area have COVID-19, and it says nobody in the state of Georgia have COVID-19. I think I have came to the reality to say once again that this is another way to depopulate the earth. Cause you let these people come from the affected areas, go back to their countries, and then you'd be surprised. You're like, oops, surprise. I wonder how they're gonna target Africa. How they gonna target the continent of Africa? What they gonna start at there? Are they gonna say? Are they gonna use this for excuse the people that try to come into Italy from Africa illegally, don't contract the disease, so they had, they're gonna send them back home, say it came from there. When they say, oh, Italy detained Africans out the sea. This is gonna be the breaking news to me. Italy just contained a boat of Africans from out the seas, and they sent them back home to their home country, not knowingly that 2 or 3 people was affected by the coronavirus. I can see that headline coming up, and it'll spread throughout the nation. I can see it. Cause like I said, Africa is the only continent now that haven't been affected by the CVN, COVID, COVID-19. That's the only continent that had never haven't been affected. You know they ain't gonna let that slide. I know it sounds like I'm talking a conspiracy, but it sounds like a month ago when I first started talking about the CDC, it sounded like a conspiracy to a lot of people, but it don't turn out to be true. Where is this money going? Because you already got private companies already have researchers and scientists searching for an antidote. Now they asking for 8.5 billion. They need to tell. One day they're gonna be honest. It's gonna take about 15 years before this be declassified and found out that yeah, they try to eliminate the population. That's my opinion. Cause I know for a city in Italy to be 50,000 people, how it come so popular? Why are so many cases now? People now leaving that city and taking it somewhere else. Look at like in Iran, the people leaving Iran, going back to Iraq, Kuwait, and other countries in the Middle East, spreading the disease. It ain't like they just found out about the disease. They ain't just found out Wuhan and all them, and that place in Italy and in Iran. They ain't just found out the jump. Mm, mm, mm. It said in this article, it said Papa John said he has closed about 50 franchise stores in China as a resort to the outbreak. I ain't no Papa John was popular in China. It barely popular in the United States. It's although the pizza company said the impact of the store closing isn't currently determining the earnings. They worry about the money. They worry about now. They're just talking about the impact COVID-19 will have on the stock market. They're showing all these different countries that they have shown all these different companies that losing money. It's all about money. You know what the bad part about it? I'm sure somebody profiting off these people death. There's somehow, some way, somebody making some money off these people who dying from the coronavirus. Cause you ain't gonna be able to bury them the natural way. Cause they don't know what the effect they're gonna have when they be in the soil. You might have to do like they did the E. coli, not E. coli, the Ebola virus. Had to burn them and stuff like that. And when you scroll through this website, when you scroll through the Google, it just talking about all these different countries being affected by COVID-19. In the elementary way, are they detecting people? Putting a little temperature gun to their head So, huh? You don't have the disease. You don't have nothing to worry about. And but zero, they already having a crisis. Economic crisis down there. So, and they having that carnival right now. The people ain't gonna be worried about the coronavirus. Not right now. If they partying and getting drunk, some of them I don't even know about it. Period. You know, the people in the United States don't have too much detail on the coronavirus. This guy at work, him and I, we really don't talk. You know, but I have on, I be advertising my YouTube channel, and he concerned about the coronavirus. So cause he had asked me what kind of topics I talk about on my YouTube channel. I said I talk about the current events. I talk about the coronavirus and all this stuff. So every time he see me at work now, he always asks me about, man, you heard about the new details? I said, yep. I just said, like I tell him, I said the new world order. They don't found it away. And then I seen an article today. They asked the question saying, do you think the 2020 Olympics will be affected by the in Japan by the coronavirus or COVID-19? I already had gave y'all the answer last week. I gave y'all the answer last week. I said if the COVID-19 is out of control in Japan, American athlete is not going. The United States athlete is they not going to Japan. Is they have that they don't have that outbreak under control. No, American athlete they know if they get affected, they stuck over there. They ain't going. Without the United States athletes, Olympic is nothing. And I'm not just saying Olympics, United States athlete make the Olympics, but the sponsors, the TV coverage come from United States. The NBC, they wanted to high, they cover the United States. So if the athletes don't go, the TV network ain't going. I don't care how much money they don't spend. They probably do. They probably force their people to go because it's all about money. But you don't have the American athlete there. Like America ain't gonna. Most of the United States people ain't gonna watch it. You don't have no people in America competing. Be honest with you. Hold a minute. I think it's my school, my daughter's school.
Good afternoon. This is Dr. James. Today we were notified by a student of a health concern believed to be related to the coronavirus disease 2019, known as COVID-19. After researching the matter with local medical professionals, our student health service department, as well as the health department, there have been no confirmed cases for the coronavirus disease 2019 in our schools, community, or the state of Georgia. There are several types.
That's the second time they sent the message from the school about that right there. But like the last video I did Monday, I said, it's time to be scared. It's time to be scared, people. So as we can see, it's not just in our government who ain't gonna tell us everything. Your governments all around the world ain't telling their people everything. Hmm. Yep, it's time to be scared, people. And the sad thing, we don't even know who to trust. We can't trust nobody. I wouldn't trust nobody. You know, especially if they government officials and stuff like that. I told y'all. I know I keep on saying I told you so, but I told y'all about the CDC when they came out and said that jump. Like, oh shoot, man. I don't know. I don't know what's gonna happen. It's a weird time right now. I know it. There's a lot of people. Don't get me wrong. There's a lot of people surviving this COVID-19. There's a lot of people surviving it. There's quite a few people dying from it also. There's a lot of people dying from it. This why I said in the beginning, I don't believe this disease came from a meat. Because it transfers from human to human too easily. Because the more and more we hear about this disease, it's the more and more we don't believe. The more and more I don't believe it came from meat. I still say it came from a lab. Some science that created the COVID-19 out in China. I don't have the proof. Other people who said they don't have the proof. But it's just the coincidence. The the lies we were told. First it came from a darn armadillo looking thing from China. Then it's somebody came from bats. Then it started name other stuff. It came out of a lab. That's where it came from. Yep. God damn it. Only thing we can do, take precaution. Wash your hand. Make sure your children wash their hand. Maybe we have to start wearing masks too. Hmm. Might gonna have to start wearing masks too, man. But what the mask gonna do? Cause you know they haven't confirmed that the mask is protecting the people. You notice that? You notice they never confirmed that the mask is protecting the people. They're just saying the people wearing masks. They ain't saying the mask doing anything for them. Have you heard? Have you heard any news? Y'all hear my dog? Nobody ain't outside. Nobody outside. He just He barking because he's spoiled. That's the only thing wrong with him. He's spoiled. But yeah, back to that mask. They ain't these people volunteering. The people you see on the news and stuff like that, they volunteering wearing these masks, but they still ain't saying these masks protecting them. Cause you could be getting that disease just by the touch, not just because they're coughing and stuff like that. Man, it's a pandemic now. Only thing I can say is keep your immune system strong. Do the best to keep your immune system strong and all this stuff. Cause that's seem like the only way people surviving this COVID-19 if they healthy. If they already healthy. If you got something serious going on, seem like that's the only way people dying. So drink your water, take your vitamins and all that stuff. Man, you normally hear about stuff like the Ebola and West Nile and stuff like that. You really don't be concerned because you like, eh, that's over in Africa. I'm being honest with you. We hear about stuff like this chicken flu and all that kind of stuff. You're like, oh, it's not close to us. But this time, I think this is one of the most spread disease in the world of my time, as I know of. I know, as I've been alive. You since I've been alive, I never heard of a virus being spread all over the world, except Africa. Once again, Africa don't have it. But I never heard of a virus being spread all over the world, and they still don't know the source of what caused the virus. One day they're gonna start lying to us, y'all. One day they're gonna tell us that eh, China was working on something and somebody got out the lab and he was contagious or she was contagious, or they just practiced on somebody and sent them home or sent them home. Cause what the chances are, as you can see, is 81,000, and some people so far confirmed have had the coronavirus. What are the chances are on 81,000 people just coming in contact with each other? Okay, if it started in Wuhan, but I get that's just showing you how it can start at one place. You see how I'm touching my face and my hand, my face, and all this stuff. That can easily how it can spread easily like that. So I don't let the virus on a pole or something like that. A rail, you putting up the handrail, you just like watching your face get sweat or something out your face or your face itching. And they say they coming from the animal. They ain't coming from no damn animal. Like I said, there's only one continent in the world now that haven't been. There's only one continent in the world that haven't been affected by the coronavirus. That Africa. Damn. COVID-19. And they still ain't saying where the $8.3 billion going. Man. All right, I'm about to go ahead and get out the video. I just want to let y'all know that don't send the sick man down to South America now to spread throughout South America. Damn it. I'll talk to you later. I hope you all have a nice day. Once again, if you haven't subscribed, subscribe to the channel. Hit the notification bell. Hit the share button if you feel like it. Hit the like, hit the dislike. Tell me where you think I'm wrong. I'm here to listen. My ears wide open. Yeah. They wide open. Thanks again for watching the video, and I'll talk to you all later.